I got asked today, how do I work with a woman in perimenopause or menopause who is on hormone replacement therapy? Like, what do I do then that's any different? And that's a really interesting question. So, here's a little bit of how my naturopathic medicine brain works. So, I guess first of all, I would say if a woman had symptoms going through the menopausal transition, and she went to see a provider and they put her on hormone replacement therapy, and all of the symptoms went away, and then she wouldn't have any complaints, and I wouldn't really need to do anything, right? And she may be seeing me for something different if she's seeing me at that point. And so I'm not really worried about menopause symptoms in that case. But the question was more about the way I interpreted it was, well, what if they're still having symptoms? What are you going to do then? And this is a great example of how hormone replacement therapy is not a silver bullet. And that is because hormone changes are not the only thing going on. They are a major driver of many of the changes that are happening, but a lot of the symptoms that you experience during this time of life can be for different reasons. So your HPA axis could get dysregulated, imbalanced. That's your brain adrenal connection. This is very common. And if that happens, then you can have fatigue or tired, wired sensations, trouble sleeping, maybe brain fog. You have decreased resilience to stress, mental and emotional and physical stress. Just one example, you can have gut dysfunction, which is pretty common, and dysbiosis and intestinal permeability, or what you might know as leaky gut, and that will create fatigue and brain fog and inflammation and potentially like joint and muscle pain, skin issues, so on. So I really think of it as, okay, if you're on hormone replacement therapy, what didn't it help? A lot of times women will say, I still have brain fog and I'm fatigued. It really helped my hot flashes, my night sweats are better, maybe sleep's improved or something, but it's like, yeah, I still kind of feel crummy. And that is because the missing hormones or the decreasing hormones weren't the only issue. And so I am like a detective, right? I'm digging, what's the underlying root cause? And, of course it's possible that there's another disease diagnosis, but most of the time it's a functional situation. It's a dysfunction in some other body system or body systems that needs to be addressed. So maybe there's subclinical hypothyroidism. Maybe it's the HPA axis, right? Gut dysfunction. Maybe you still got a lot of inflammation that is from another cause, like a chronic infection or something. So there's lots of things to consider. And as a naturopathic doctor, I'm thinking about what is the story that your symptoms are telling me, and using that as the roadmap to understand what is the root cause and how do we help rebalance and increase the function of those systems that are imbalanced, that are creating the symptoms that you're experiencing.